Hello, I'm Dr. Tadrus, and first I would just like to explain to you what a cataract is, how we address it, and some of the different options that we have when we do so. So first, what is a cataract? So I'm going to show you here on this model. The cataract is the natural lens of the eye, and that's this clear structure back here that sits behind the colored part of the eye. And that clear structure, over time, with age, gets a little bit darker and denser, and it limits the amount of light that's able to penetrate through the front part of the eye to make it to the nerve in the back. And so when it gets dark enough, we have to do surgery for it. This is very common. Most people will need it at some point in their lives because cataracts is something that affects everyone. So when we do the surgery, what we're doing is taking out this dark old lens, we're replacing it with a new clear lens. So with that, there are several options in terms of what we do at the time of surgery. The first option is one that we can bill insurance for, and that's the lens that is nice and clear, gets rid of the cataract, but you will likely need glasses, both for distance viewing as well as any up-close activities such as reading or really anything else that you do up close. The second option that we do allows us to do some extra laser measurements, which help in a couple of different ways. First is it helps us confirm the power of the lens going into your eye, because although we do a lot of measurements before that, it's most accurate at the time of surgery because we can measure after the cataract has been removed. The other benefit of this laser is it helps us to measure and correct astigmatism. Astigmatism is when the surface of the eye is shaped a little bit more like a football instead of perfectly round like a basketball. And if that's the case and we detect a significant amount of that, we can make some corrections to the surface of the eye that make it more round. This helps you see better after the surgery, both with and without glasses. And then there's the last kind of lens that we utilize, which is the newest and best technology available, that aims to give you the best possible distance and near vision. And by doing so, it minimizes the need for glasses. Now I say minimize, not eliminate, because you may still need some help with glasses for really fine print or something really far in the distance. Now most people function very well on a daily basis with that kind of lens without glasses, but there is that small need that will remain. A couple of things to bear in mind with that lens. One is that it can cause a little bit more glare, meaning that bright lights might cause some halos around them, and that's true for any kind of lens, the natural lens of the eye, as well as any implanted lens we put after cataract surgery. But because this lens is a little bit more complex, correcting distance and near, it comes with a little bit more glare and halos around lights. The other thing is it can cause some decreased contrast sensitivity. What that means is bright reds and greens may not be quite so vivid. The last thing I'll mention is that it also has a out-of-pocket expense that insurances don't cover. So again, that's something that we can discuss further if you're interested and qualify for that kind of lens. So that's a general overview of what a cataract is and the different lens options that are available. We can discuss them further, and any questions you have, I'll be happy to answer when I come in and see you.